Hi everyone. Happy RT Week. It's Paula Smith, President-elect for the Respiratory Therapy Society of Ontario. I'm really thankful that you've chosen to spend time with us for this webinar today. I am really excited to introduce Murray to you. I saw Murray at the Kingston Emergency Conference, and his session was so captivating and engaging and really useful and applicable. And I know everyone walked away from that session just with things and tools and a different perspective on how we can really engage in self-care. I think as respiratory therapists, we undervalue the critical situations that we're involved in and the stress that's put on us. And then if we add in COVID-19, I think we can all say that we've felt these extra strains and stresses on an emotional level, workload level, work-life balance level. So I'm really happy to have Murray here today to share his knowledge and experience with us. Now, I will let you know that you're not able to chat or put yourself off mute with this interface, but I would pretty please encourage you to put your feedback or any questions you may have in the chat box. If the content is resonating with you, let us know. I will read those to Murray as the moderator. So Murray is a registered nurse and has worked in various professional capacities in healthcare for 40 years. His areas of service have included administration, education, emergency, mental health, psychiatric emergency services, and his practice also included having been a master level instructor and consultant in both crisis and suicide intervention. His clinical experience and expertise have made him a sought-after speaker. He gives keynote speeches, he's highly interactive, which is obviously a challenge with us doing this mobile. But his seminars have been conducted at all levels of government, academic institutions, and private corporations. He currently is a clinical educator, professional practice at the professional practice department at Providence Healthcare in Kingston, Ontario. And he's also a professor at Algonquin College in Ottawa. And he's held development and teaching positions in the Paramedic, critical care, mental health, and allied health program. He actually teaches RTs, which is amazing. And in speaking with Murray, he's put a lot of thought and effort into this presentation. And I really feel like he really understands us as respiratory therapists and human beings. So welcome, Murray. Thank you for your time. I'm going to pass it over to you.
Hey, good morning, ladies and gentlemen. And thank you for letting me be with you during this hour. I so wish we could be together in person. I feel so handcuffed doing this presentation with you. Sitting behind a computer is not my teaching style, and I'm not here really to teach you anything today. I would be really happy to be able to engage in a conversation with you. I want to start off by saying that, and thank you, Paula, for introducing me. Yes, in fact, I am the only nurse that teaches in the RT program at Algonquin, and I'm very proud of that. But because of that, having that association with them for the last 7 or so years, and having worked with you in the emergency department and critical care throughout my career, I say this from the heart, with no falsity whatsoever, I have a tremendous appreciation for what you bring to the table as part of the interprofessional team. You are an invaluable source. I celebrate your week this week, and your weight is worth gold, believe me. And so I'm honored and privileged to have been asked by Paula to come and have spend an hour with you today talking about something that we often forget about. And, you know, one of the common characteristics of most healthcare professionals, and very specifically RTs, is you're very altruistic by nature, very good-hearted. You will put other people first and sometimes ourselves last. I'm going to be talking specifically about some of those challenges in COVID world today. I think you'll probably recognize most of it. Folks, I want to tell you right now that the presentation I'm about to give, and I talk a lot to various organizations, but specifically to healthcare professionals like yourselves. I have to say, there's no magic formula. There is no magic anything. But when we are in the throes of a pandemic like this, when our professional and personal demands on our time and very, very constricted situation, our abilities become a bit overwhelming and out of control. As much as we'd like to be able to handle it all, we have to go back to the basics. And even some of the things that I may talk about today might sound rudimentary. I've put it together in a package for you, and I will be talking to you about some of the key research pieces that I'll talk to you about, but it's very basic, it's very rudimentary, almost simplistic in nature. And I don't want you tuning out for that reason. What I'd like you to do, and what I'd like to do, is engage you in the next hour. And again, I'm so sorry I can't speak with you directly. I'd like you to think of this. I like to use this analogy. For all of you that have been on a plane, and I know you all, I'm sure, have in your travels throughout your lives, you always remember when you go on a plane and sit down and they begin the orientation and the process of safety. And they always say, if in the event, I always love the way they put that, in the event that something, untoward might happen, oxygen mask drops down. If you have a child with you, who would you put that mask on? Well, you wouldn't put it on the child. For obvious reasons, you would put it on yourself first. For the next hour or so that we're spending our time together, I would like you to think in that modality. I'd like you to think about, all right, I need to be taking care of me first. Because if I'm not around, I'm not going to be there to take care of anybody, either professionally, the patients that are in your care, or clearly your family, which are really, for me, the most important. So let's spend this hour together. I'm going to go through the slides with you. The slides for me are talking points. And I really prefer to talk off script more than anything. So I'll use the slides that you'll see as basically a guide to our conversation today. And before we get started, and I'll give you a minute or two to do this, we're going to do a little bit of a self-test today, a 10-question self-test to see where you're at. And so a piece of paper, foolscap, anything that you might have, back of an envelope, and a pen, writing instrument, pen or pencil. And when we get to the point that we're going to do that, and that'll be very shortly, I'll instruct you as to how we're going to do this and then how we'll score it. Hope you have a little bit of fun with it. And it really is just a snapshot to see where you're located today within the stress environment. All right, so let's go to what we're going to talk about. And oh my, why is that not moving forward? Okay. There we go. Okay, so during the presentation, so really this is the menu for today. We're going to talk about some of the key issues you're faced with, the impact on your health. Let's find out where you're at right now, and then I've got what I call the 7 secrets. There's 7 key domains of things that you need to be looking at for yourself within your own health, both mental and physical, in order to try to face this pandemic with some kind of teeth and come out of it on the other side. Not just survive, but I hope maybe thrive. So let's take a little bit a look at some of the common COVID-19 anxiety factors that are out there among all health professionals. Really wish I was having, again, this dialogue. I know I'm sounding a bit redundant here because I could hear your feedback, but I'm going to go through assuming that you would agree. I would hope for the most part that you would recognize these. So I'm going to put these up on the screen for you. Let's take a look. These are some of the common COVID-19 factors, not just for RTs, but common across the board. Look at the things that they're worried about, and this is reported in just about every research piece that I got. Ease of transmission of this particular illness. Now, I was working during 2002 and 3 during SARS. I was working in a couple of different emergency departments at that time. And, we had to go through the full PPE, and there was a lot of fear at that time. I think this completely outdoes that, because the ease of transmission of coronavirus is so virulent. Lack of immunity, and that's global, by the way, all over the world, the lack of immunity. I know, there's a lot of controversy about what's going down in the States right now and the various campaigns. Gosh, I didn't want to get into the politics of anything, but I think this statement speaks for itself. There are 2 different approaches down there, and I'm only supporting one of them, and that's really taking care of ourselves with masks and so on and so forth. Delayed or disorganized testing. So a lot of the systems in various cities are set up in different ways. sometimes not very quick, and sometimes not very effective. You have to wait for a fair period of time to get the information back. Limited medical equipment. I will be talking to some of these a bit later. And the uncertainty of the pandemic trajectory. Remember, during the summer, we were in a bit of a lull, numbers were down. And of course, you and I both know over the last couple of weeks, we started to see the numbers going up and they're starting to peak again. I guess yesterday in the States, they hit somewhere around 89,000, if my memory serves, per day. That was yesterday's, that was the highest peak since the pandemic. And I know here in Canada, we're starting to peak on the numbers in Ontario and Quebec again. Hope I'm not going too fast along for you. And if I am, please just type it into Paula and I'll slow down. All right. When I did my research, Paula was quite good at sending me some information. I asked, what things are you currently facing in the various areas that you're working? And I know a lot of the areas that you're working right now are in the critical care areas, ER, CCU, ICU, PICU, NICU, so on and so forth. And some of you are in community and clinics. I understand that. Globally, however, some of the stuff that Paula sent me, I think it was 12 or 13 pieces, and I did my research, they actually collated into what we called the top 8. Some may be specific to you, some may not, but these were the top 8 concerns driving increased stress and anxiety, and it was clearly specific to the RT population. Here we go. Number 1, access to appropriate PPE. Access to appropriate PPE seems to be a problem just about everywhere. I know some have the appropriate amount, and I know others do not. It depends on where you work, but that's a major concern for all. One of the training pieces that I do at my hospital, I'm in charge of code responses and race team. One of the things we were concerned with was having appropriate PPE for the race responders. That took us a while to get because funds were not there. No insult to the institution, but it just took a while to get. We were shy of PPEs for a while specific to that. So I'm really glad we have it now, but it could be in other places as well. Being exposed to COVID-19, then taking the infection home. Lot of RTs really worried about that. And associated with that, we've seen news pieces around this, and the 3 studies that I read here in Canada and one in the States, very similar, the stigma in the community about allowing us to go in and do our banking or do our groceries at the grocery store. There's a very definitive stigma out there, and if you think it was just in your community, you have misthought. It is everywhere. And I was really surprised when I saw the statistics coming back. Not having rapid testing available, therefore, potentially propagating infection at work. Good example of that, I just was on the phone with a colleague of mine yesterday in Ottawa, and globally there was a couple of nursing homes up there where a number of the staff were testing asymptomatic. They were, asymptomatic, but they were testing positive. And so we saw it propagate throughout work where people thought they were fine, but as they increased the testing, they started to see that not only the patients had it, but some of the staff had it as well. And then, do I have it? Am I bringing it back into work and infecting my colleagues? And of course, once that happens, we have to isolate and go home. And the next thing you know, we have a shortage of work staff. And currently we're not too bad, but we are expecting that shortage to happen if this continues. Uncertainty, if the organization will support or care for, your own personal and family needs if you got infected. There was a lot of feedback on that. Here are the last 4. Access, for those of you that are raising children, access to childcare during school closures or your own increased work hours or demands. And what happens if both of you are in the people profession, healthcare or police, fire, whatever? How do you arrange that while you're essential workers having to go to work? You also have to care for your children and make those arrangements. We saw a lot of people really increasing anxiety and stress over that. Personal family needs, work demands increase, things like lodging and transport. A number of our folks have had to go and stay at a hotel for fear that they were bringing it home to their families, and maybe some of those families had elderly people at home with comorbid conditions. I know I am a cardiac patient. I'm a diabetic as well, and I have had to really be cautious about protecting myself so that I'm around so that I can teach and care for others. Number 7, the need for the most up-to-date information and communication. Now, I have found that to be really diverse across the spectrum. Some hospitals are sending out a weekly update for their staff, some daily, depending on, and some, not as regular and not as informative. At the end of this, I never like to leave you without giving you some tools and some information. And at the end of this presentation, please stay tuned, because I came across a plan, a document that speaks directly to having you advocate to your organization. And even though I only have it on one slide and I talk to the 5 things that you can do to talk to your organization about this in a positive way, something they could probably take up, I will send to Paula the actual table with all of the breakdown on what can be done and how it can be done. And I think Paula would be able to put that up on your site, and you can have access to it. I know that I am meeting with some of my administrative staff on Monday, and I'm going to be talking to them about the 5 key things that you can bring to your institution. And then the last one is increased workload and a changing workplace. I think that speaks totally for itself. Your workload, the way that you're able to function at work. We're all wearing masks, obviously, at work. The PPE you have to put on, the difficulty with that. I know our O2 sats drop a little bit when we're wearing masks, and I know they drop even more when we're wearing the N95 masks. And I know back in SARS time when we were wearing the N95, nurses and RTs, physicians, getting headaches because we're a lot, and that's just the offsetting stuff. Folks, really, those were the top things that were of concern that came forward. Where are we going with that? So what happens? Well, there's a toll of on us if we don't try to manage as best we can the stress that we're facing. Now,
Murray,
come on, I'm a realist.
Sorry,
Yes.
I just wanted to read a few of the comments. So these concerns are really resonating with people and on the line. And another additional comment was I would also say that having these stressors, but then not having the ability to decompress in normal ways, for instance, getting together with friends and family, going out for a fun night, is compounding.
That's great.
As well.
Thank you. Whoever wrote that in, brilliant. Thank you. We're going to be speaking to this, and what a need, and the inability to be able to do the things we would normally do to decompress, to keep that balance. We're constricted. We really are. And I'm hoping that I can talk directly to that. But again, no magic formula, but I think I've got a couple of things that might be able to help. Folks, I want to talk about that. Thank you again, Paula, for jumping in there. Want to talk about, okay, there we go. You might hear some noise as I slide in each of these ones, but I'm going to talk a little bit about what's the toll of unmanaged stress. And folks, some of you may be experiencing these now. Look, I'm not teaching you anything here today, but I'm trying to have a good dialogue. We're all colleagues having a good discussion now without the patients around. And let's really just have this dialogue. Good common sense stuff here. And let's take a look. So addictive behaviors, and all of the research that I've done recently, talking to my own staff, going from institution to institution, really having these dialogues. Addictive behaviors, we're starting to see people, they're not exercising as much, they're overeating in some ways, but we're starting to see other addictive behaviors. Higher alcohol consumption, higher depressive rates because of that, that and other things. Some domestic issues. We start looking at the toll of unmanaged stress, relationship distress. And again, the numbers are correlating now where we're starting to see issues on the home front. And I am pulled aside I would say fairly frequently by folks. They know they can talk to me in confidence. I believe that to be true, and I hold it tight to my heart. Marie, do you have 10 or 15 minutes? Absolutely. Let's chat. And what I hear, and quite often with tears from them, is the impact that it's having on them personally and on their families, and how it's affecting them. So relationship distress. Another one. Why is this not? Oh, sorry. There we go. Emotional and behavioral problems. I'll bypass that for a minute. I want to attack that in a bit. Professional consequences. If we get so overwhelmed, then we start calling in sick more and more. If we're doing more addictive behaviors, this can affect your registration, your license, and all of this can lead to burnout. And that's kind of where I'm heading today with regards to my talk. I want to make sure that you're avoiding burnout. Okay, what I want to do is I want you to take out a piece of paper and a pen, and on the left side of the paper, and I'll give you a few minutes to do this, I want you to write down the numbers 1 through to 10. So 1 to 10, because there are 10 questions I'm going to ask. And then at the very bottom of the page, I'm going to put a slide up here. This is what I want you to do. I want you to write A, B, C, and D, and this is how you're going to answer the questions. So please write down A, almost always, put that at the bottom of the paper, B, often, C, seldom, or D, never. Now I want you to have a little bit of fun with this. No, and for gosh sake, please, after the test is over, do not put an emergency call into your doctor asking for Ativan. Don't, seek that. Honest to gosh, this can change at the drop of a hat. But it's kind of like a Polaroid snapshot for those of us that are old enough to remember Polaroid cameras. Polaroid snapshot of where you currently are with regards to your own self stress level. Okay, so again, bottom of the page, A, almost always, B, often, C, never. And when I ask the question, I'm putting 3 up at a time. I'll walk you through them. I'll talk you through them. Then I'd like you to answer A, B, C, or D. At the end, after all 10 are done, I will tell you how to score it, and then I'll tell you what those scores mean. Okay, folks. So I hope everyone has that done, 1 through to 10, A, B, C, and D at the bottom. Let's go to the self-assessment test. I hope I gave everyone enough time. Here we go. How often do you, number 1, find yourself, please place yourself at work now, with insufficient time to do the things you really enjoy? Now that can be at work or at home. It's entirely up to you, the domain that you're choosing. Number 2, how often do you wish you had more support or assistance? Again, that could be work or home or both. Number 3, how often do you lack sufficient time to complete your work most effectively? Remember now, you're answering A, B, C, or D. Next slide. How often do you have difficulty falling asleep because you have too much on your mind? Oh my gosh. How many, and I can't see you, so I'm just going to say, think about this, folks. I don't know how many of you ever done this. Woken up at 2 o'clock in the morning and your mind is just going on fire. You cannot shut it down. I'm going to give you a tip for that later on. Or have you ever done this? And I always find this interesting about anxiety. So you got to get up at 6 in the morning and it's midnight and you go, okay, if I go to sleep now, I can get 6 hours of sleep. And then you look at the clock again at 12:52. Oh my gosh, if I go to sleep now, I can get 1:37. If I go to sleep now, 2:07. If I go to sleep now, and what are you doing? You're stressing out about not going to sleep. So that when you wake up in the morning with only 3 hours of sleep, you're really stressed out and tired. I know a lot of folks that do that. I've done it. We'll talk about that a bit later. All right, number 5, how often do you feel people simply expect too much from you? Again, work or home. Number 6, how often do you feel overwhelmed? Folks, that can be anything, mentally, physically, however you want to frame it. Okay, here we go. Next slide. Somewhere, whoops. Number 7, how often do you find yourself becoming forgetful or indecisive because you have too much on your mind. Okay. Number 8, that happens to me all the time. Number 8, how often do you consider yourself to be in a high pressure situation? Now that's different for everyone. This is very specific to you and your life. Okay. Number 9, how often do you feel you have too much responsibility for one person? Again, could be at work or at home. I know that the responsibility for RTs in one of the hospitals that I worked in when I was working in critical care, let me tell you, there was just a ton on your plate. Deep respect for you. And the last one, number 10, how often do you feel exhausted at the end of the day, mentally, physically, or otherwise? Okay. All right, folks, let's add it up. For every A answer you gave yourself, you're going to give yourself 4 points. For every B, 3, C gets 2, and D gets 1. I'll repeat. A answers get 4, B answers get 3, C get 2, and D is 1. Sorry. Take your time, add up your scores, please. Okay. And I will put this up now. If I had you here with me today, I would ask, okay, how many people got under 20, 20 to 24, 25 to 29, 30? I would show by a show of hands, and you would hear all the gasps in the audience as to how many people actually had over 30. Let's take a look.
Well, Murray, I'm at 30. I'll share mine. I'm at 30. And anyone else, if you want to share in the chat box, I won't identify your name,
There you
but
go.
I will share your score. But I'm 30.
Thank you. So less than 20, this is strictly with stress. Less than 20, you're doing good. 20 to 24, average, but some stress issues. 25 to 29, have to start to address it. 30 and over, this is where you need to pay close attention. All right.
33, so 33, 28, 30, 23, it's Friday.
Yeah, it's Friday.
33, 30, 19, 33.
Oh, 19, good for you, whoever that is. All right, folks, listen, this is the interesting thing. And I always find this interesting because I've always kept one foot in each world, mental health and physical health. And we often have a tendency to separate the mind and the body. And we need to stop doing that. And you need to know, you'll have to trust me on this, folks. I apologize. I wish I could throw the stats up and show you. I run a number of programs outside of here on the mind-body connection. For every single thought that a person has, negative or positive, there is a physiological result. The best example I can give you is somebody with a fear of flying. Folks, I could just talk to them about flying. Picture them in a cockpit or a plane. And if I had a pulse oximeter on them or a biofeedback machine, you'd watch their pulse go up, their O2 sats would be changed. Sometimes their body temperature changes. And if I had a blood pressure cuff, you would see it go up. Interestingly, I didn't do anything with them. They didn't move. They weren't running up and down the stairs. They weren't sitting on a plane. The power of your thoughts absolutely has a physiological effect on both your sympathetic and parasympathetic nervous system. A very powerful effect. And I'd like you to keep that in mind when we're going through the next section here. So let's talk about compassion fatigue. I know these are general terms. Compassion fatigue. I just want to talk a little bit about burnout and compassion fatigue for a second. I'm going to talk about some of the symptomology. You'll probably see yourself in some of these, but then I really want to get into what can we do about it. So let's talk about this. Okay, compassion fatigue. There's actually a field called traumatology. It's known as secondary traumatic stress. In compassion fatigue, the terms that I used to use, it's the cost of caring, or the cost of caring too much. And it can lead to burnout. Compassion fatigue can generally be turned around fairly quickly. Depending on which stage you are in burnout, it takes a little bit longer. But if you recognize it and start to address it with some of the simple basic components, you can avert it or you can reverse it, and it is reversible. Let's talk about this. And I wanted to show you a stat that I pulled up. I know this is a bit of a busy slide, but you can read it. So burnout in emergency department healthcare professionals is associated with basic style. So 615 emergency department staff members were given these two evaluation tests, and the results were this. Critical care staff working 6 to 10 years, so they had that background, had higher emotional exhaustion scores and higher depersonalization scores. Now, what do I mean by depersonalization? Patients were seen like on a production line, more like numbers, really not being looked at as people. Now, look, I'm not here to say, bad things about the staff. That's not the case at all. They're not bad people, but they were in burnout. And I do want to talk to you. In order for you to be able to protect yourself, you need to be looking at key things. I'll talk to some of the symptomology here for a second. Please take a look at yourselves, see if you're experiencing any of the following. Okay, so what burnout is, it's basically a syndrome of these things: emotional exhaustion, depersonalization of others. So you really start to not appreciate people for being people. Okay, they sort of become objects, numbers, so on and so forth. And here's the key: the perception of reduced personal accomplishment as a result in COVID of intense involvement with people and situations. I'm sure that you have gone in on shifts, depending on where you work and the intensity of what you do, and wonder whether whatever you're doing, it makes any difference at all. I can tell you many times where I had gone in on a 12-hour emergency shift and several people died, cardiac patients died throughout that shift, and got off at 7 o'clock in the morning wondering, what the hell did I just go through? Everything I touched seemed to die that night. Like, were you making any difference at all? And you know as well as I do that sometimes in the continuity of care from A to Z, we sometimes never get to know. Paula and I were having that conversation just earlier. We never get to know the outcome. We just go in and hope that whatever we do makes sense, it resonates, and it makes a difference. But we'll never know. We don't do it for pats on the back. You and I both know that. And we don't do it for a paycheck for the most part. Oh yeah, the pay is nice. Yep, I like my paycheck. I think you all do. We want to, feed our families. But at the end of the day, we do it for more than that. Otherwise, you would have chosen another field. There are 3 main stages of burnout. I'll name them. I have not put the breakdown of the 3 stages in this PowerPoint slide, but I'll be happy to send you the information. I've done something a bit more generic to talk to you about the 3 stages. Stage 1 is stress arousal. That's where you know something's wrong. Your body's getting ready for it. So in the overhead, if it was like a code blue or cardiac arrest was coming in from the paramedics, something along that line, you're getting ready for it. That's not necessarily a bad thing, but it means that your coping skills, your body is being taxed a little bit. Now, I want you to start thinking about COVID times and what we're faced with. Number 2 is energy conservation. So you're psychologically, and your body knows it's starting to get overtaxed. So you might start doing some things like cutting corners, might be starting to show up a little bit late for work, or turning a project in a little bit late, or really cutting corners in your own time away from your kids, time away from your spouse, time away from something where you're trying to get a little bit of time for yourself, sleeping more, maybe getting involved with something that will help you sleep more on a more regular basis, like maybe Gravol every night, something along that line. This is energy conservation. And the 3rd stage, being the worst stage, is, where am I here? Exhaustion. And there are key components in all of these. I'm going to general physical and emotional to look for, and depending on how severe these are, you would be able to place yourself in one of the 3 stages. And again, I have this broken down more articulately, more than pleased to show it to Paula or send it to you folks later. Here we go. Some of the common signs and signals of stress. So think about this. You might see some of this in yourself. What we hear a lot of is chest pain, people having small panic attacks, headaches, rapid heart rate, Bruxism, that's the grinding of teeth. Dentists will often pick this up. They've grind their teeth down to next to nothing, and they'll say, are you under stress? And they'll start going through that component. So what we're seeing here are cardio, respiratory, or digestive issues. You can look at some of these, and depending on how often you're having these, it would put you in a certain classification of the three that I talked about. Emotional, you start looking at some of these. Now, I want to talk to a couple of these very directly. We are seeing an abundance, an increase of depression in healthcare professionals. Being overloaded with the stresses that you're under, we're starting to see more depressive features, complaints, and some of that comes from what we call cognitive distortions. So some of the things that they're perceiving about their lot in life, their role in the family or at work, and how they even think about themselves is on the increase. A lot of anxiety, which is driving depression, and we are now starting to see an increase in suicidal thinking and actually some suicidal behavior in the healthcare environment. Folks, I've been in this field for 41 years now. I've lost 4 very close colleagues to suicide, a physician, 2 nurses, and a paramedic. I have to tell you that under the right circumstances, everyone is susceptible to depression and suicide. So be there for not only yourself and your family, please be there for your colleagues as well. And if they're talking about depressive thinking, spend some time with them if you can. Explore that and get them some help if you can. I'll talk to that shortly. All right. So let's go on to ways to manage personal stress. Okay, these are a bit generic, but I'll talk to them for a second, and then I want to get into the 7 secrets with you. Okay, ways to manage personal stress. Managing yourself. I am going to be focusing on that with the 7 secrets. Also, managing your reaction to stressors. Okay, I will talk about that during the 7 secrets because I think it's really important on how we are able to better manage our reaction to the stressors that we're facing. And I know you're sitting there going, Murray, what the hell are you talking about? Well, I think I can address that straightforward. At least I hope I can for you. Managing the amount of stress is easier done I shouldn't say easier done, but it's something more tangible and constructive at home. And I will talk a little bit to that. Managing the amount of stress at work, much more difficult during the pandemic sessions here. You can't control who you work with. You can't control what patients you get. You can't control the environment sometimes. And so in all of that mayhem, there has to be a locus of control that you actually can control. And when you walk out those doors, there are components of what you can. While you're in that component or mayhem, there are certain things that you can do to control your own thinking. Because whatever we perceive on anything in life, really, but at whatever we perceive in life becomes our reality, and that's how we behave. And if we perceive that all is lost and everything is out of control, that becomes our reality, and it's almost self-defeating. And that becomes our behavior. And so we may drink more or take more pills or become very depressed. If we alter our perception, and I do this a lot with with mental health nurses when I'm talking to them about patients that are suffering from delusions or hallucinations, whatever their perception is, that's their reality. And we see that behavior. When I'm talking to professionals and they're coming to a crisis, the code team, a lot of the times when I work with the code team and I talk to them, I say, look, all hell's going to break loose. And the only thing you have control over is yourself and how you respond. And I talk to them about doing simple things like taking a deep breath in, clearing their head, and trying to be the eye of the storm. The eye of the storm is basically good and calm. I mean, you can fall apart afterwards, but during that time, taking those deep breaths in and controlling those things of which you do have control over, your own reactions, your own perception, and the ability to employ the skills that you have been so well educated on, and I'm sure many of you have multitudes of experience. All right, I'm about to share something with you. I did a cross Canada tour once before. I was part of a little group of a speaker by the name of Dr. Jim Muirhead. Jim is now retired. He was a forensic psychologist for 40 plus years. And we focused a lot on healthcare professionals and shift work, because shift work can really screw up your life. And another speaker, Charles Marcus, and the three of us did a tour across the country with healthcare professionals, and love meeting all of the folks that came, and we were basically had full halls, and we did a full day on this. Jim developed a thing called the 7 Secrets, but for something totally different. Jim handed this over to me a number of years ago, and I reworked this actually for COVID for you folks today. And so there's no magic formula. And I want to set this up by saying to you, look, folks, at the end of the day, when we're in this situation, we got to go back to the basics in order to care for ourselves. So I hope you enjoy this. I hope you don't see it to be too simplistic, because it's not meant to be, but it really does address and talk to you about, I need to address this. And we've identified the 7 key areas or domains in your own life, personal more than professional, but very personal in what do I need to take control over, so that I am the absolute healthiest I can be physically, and absolutely, most importantly, mentally. Those two have to work together. So let's take a look at the 7 secrets of healthy living in a COVID world. And again, I'm only going to use the slides as talking points. And I so, again, wish I had you in person.
Well, Murray, we just had a comment in, I love Murray, exclamation mark.
Oh, okay. Thanks. Send me a Christmas card. I'd appreciate it. Okay. And anything over $100 is great. Thanks very much. Folks, again, I'm so pleased to be with you today. Here we go. Secrets of healthy living in a COVID world. Please, please, please. I beg of you, take these seriously. And I hope to give you some information that maybe you just forgot about over time. But let's take a good look at us. Here we go. Number 1, sleep. Now, sleep is really tough when you're working shift work. Folks, I get it in spades. I've done the 12-hour shifts and I've done 24 hours. I'm telling you, it's tough. 42%, I'll say it again, 42% of the world's workforce work alternative shifts. What does that mean? Different than 8 to 4, 9 to 5. And we had to go across the country to address most of this with healthcare workers and the sleep deprivation that most of us are under, given our own personal time demands from our families and the work demands that you're facing. So let's talk about sleep. Okay. Why do we sleep? Well, we sleep to get regenerated. We sleep, it's absolutely imperative. At one time, I used to work in psychiatric emergency services in a city of 1 million people. It was so funny at exam time, I used to get a lot of students in and a fair number of engineering students. I don't know exactly why. And they would be awake 3, 4, 5 days, drinking Red Bull, getting ready for exam, and they would become basically chemically psychotic. And I remember one guy bringing his friend in saying, you know, he thinks CSIS is tapping our phone and I'm poisoning his porridge in the morning. And oh my God. And so think about yourselves. How, what was the longest period of time in hours that you ever went without sleep? You think about the third day, 20, 24, 36 hours, 72 hours, anytime after 3 days, you're basically getting into the chemical psychosis realm where you're touching things, but they don't feel real. And your thoughts are getting a little distorted. So let's talk about the need. How much do you need? Okay. Latest studies, folks, I'm giving you all the latest and greatest here. I just updated my notes last week. Latest and greatest. How much do you need? The standard says minimum of 7 hours. Now, I'm sure many of you get less than that. Raise your hands, ha ha ha, if you're getting less than 7 hours of sleep, and I'm sure many of you do. But the average that you should or do you need for proper body regeneration is 7 hours. Well, guess what? How much do you think the average Canadian is getting right now? How much do you get? Okay. The average Canadian is getting 6 hours of sleep a night. That's the average. And the average healthcare worker, especially in critical care, 5.5 to 6 average. Now, let's add that up. By the way, for those of you that think on Saturday you can sleep in and catch up, that is not the case.
And Murray, we're
Um,
getting, Megan says, I wish I got 6. And other people say, yep, I get less than 6. That's for sure.
Absolutely. And this is what we found, 5.5 to 6 was the average. If you're getting less than 7, and that's likely the case in your life, you start looking at, okay, what does that mean? So let's just do this. We lose an hour. Let's say if we need 7 and we're only getting 6, and over 7 days, if you lose an hour a night, that's a full night's sleep, 7 hours. So Monday to Sunday, if you are down an hour every night, you've basically lost a full night's sleep. And can you catch up? I hear people ask me that question all the time. No, you cannot catch up. All right. You can feel good. You can get 8 or 9 hours on a Saturday morning. Good for you. And if you get up feeling refreshed, wouldn't it be nice if we got up refreshed every day? But that doesn't happen. And I would dare anyone in this audience to tell me that you are at your best and get, leap out of bed every day and go, aha, I'm ready to go. I can't. Because if you tell me that, we've got these little pills at work called Zyprexa. Clear that thinking right up. I'll tell you that right now. Okay. Oh, I so wish I was with you. Okay, here we go. How much do you get? So COVID, stress, sleep-related problems, there's a ton of them. And we know that. You wake up in the middle of the night, your mind is going. You can't stop thinking, you're stressed out. When you leave work, what do you do to decompress when you go home from work? My God, I used to be able to, and I don't have that time anymore. Or I can't reach out to my best friend or buddy, or, gosh, I mean, there's so many barriers that are getting in the way. These following tips are very rudimentary, but I will expand on them. And please forgive me for being so rudimentary, but we got to go back to the basics here, folks. So I'm putting some up for you. So we call these good sleep hygiene rules. I know a lot of folks sleep with the television on in the bedroom. That blue light has a tendency to keep people awake. Cell phones, oh my God. I don't know how many of you folks do this, but you leave your cell phone on at night. I gave a talk in Toronto last year to healthcare professionals, 165, on the influence of cell phones and so on and so forth. And it's called a dopamine hit. And what happens is every time your phone ding goes off and lets you know of something, you actually get a quick dopamine spike in the brain. This is what causes addictions, and this is why some of the younger folks are so addicted to the phone. I actually have to shut my phone down. Everyone knows that about me. Shut my phone down between 9 and 10 o'clock at night. Do not turn it on till I'm a 5:30 guy. Do not turn it on till 5:30 in the morning, and then I will pick up any information or calls that come in. Now, you can't all do that. I get that. There may be for an emergency, so on and so forth. But, good sleep hygiene will set you up for success. Lower your fluid and stimulant intake before you go to bed at night. Lower the lights. The reason for lowering the lights is that there is a basic biochemical switch in your brain that'll flip on. Some of the melatonin gets produced, and it'll help you sleep at night. Regular routines help very much. Now, quick tip for you. I know some of you wake up in the middle of the night. And we go through about 3 or 4 sleep cycles. A sleep cycle is about 90 minutes. We go through 3 or 4 or 5 of those a night. So if you wake up in the middle of the night, your brain is absolutely going. You're stressed out about a particular something. Maybe it's something in the family, daughter, son, husband, wife, doesn't matter. This is what I'd like you to do. And this is a really good trick that I learned many years ago. It has worked very well for me, and I've shared it with so many others now, and they tell me it works for them. Have a small, like little post-it note, something beside your bed and a pen. If you wake up in the middle of the night, let me ask you the question. I know you can't answer me here. Are you actually able to solve anything at 3 o'clock in the morning or 2 o'clock in the morning? Probably not. So write it down. What's the issue? What's the problem? Stick it there and say, I'll take care of it in the morning, or I'll address it in the morning. Stick it there. You know you're going to address it in the morning, and then try to go back to sleep. It works, folks. So friggin' simple. It works. Trust me. These are some of the things. I've got lots more information around sleep for you. Happy to share that at length with Paula, and she can put it out on your site. So these are just the quick shorties because I think I've only got about 10 minutes left with you. So let's get through the secrets if we can. Eating right. Again, you're rolling your eyes, but I wanted to give you some tips here on eating. So there are two things that are happening. People are overeating, and for shift workers, think about, you're piling it in at 1 or 2 o'clock in the morning if you're on a night shift. I get that in spades. There's a reason for that, by the way. But there's two things I want to address here. Number one, or actually three. Number one, hydration. 1 to 2 liters of water, some kind of fluid throughout the day. So I use those 500 ml bottles, and I cut it off by 7 or 8 o'clock in the evening. That way I'm not up to the bathroom all night long. So I want to talk to you about are really, really hurting us right now. Sugars, that's enough said on that one, but salt. The standard body should not be getting any more than 2,400 milligrams of salt per 24 hours. That's an easy formula to remember. And for anybody with heart or diabetes, it's 1,500, but think 2,400 per day. Okay. Standard Canadian healthcare workers specifically, right? The last study done, 5,500 to 6,000 is what the standard healthcare worker is taking in right now per 24 hours. Now, salt is a really, it's a lot of insult to the body. You retain fluids, you think slower, you react slower, terrible on the joints, hard on the heart. Folks, I know I'm preaching to the converted here. So at the end of the day, what is it that you're taking in? Could you switch to more fruits, vegetables, protein? How are you eating and when are you eating? Can this be different? The whole idea is try to plan things out a little bit more effectively. By doing that, I had a heart issue 9 years ago, lost 50 pounds, kept it all off. And folks, I don't, shy away from anything. I like a glass of wine and I like some chocolate, and I'm diabetic. But I got to tell you, when I changed the way, it was a lifestyle change that I approached. I eat great stuff. I love lots of flavor, herbs and spices, but I adjusted what I ate when I ate it. The weight fell off, and I have to tell you, it was fantastic. Best thing probably that could have happened to me at the time. Okay, let's continue.
Marie, I think one of those
Now,
challenges
here's
we
one.
have with hydration is that when we're working shift, our workload is so tremendous that we don't often have time to
Yes.
go to the washroom. So we often don't drink because we don't want to have to use the facilities.
Yeah, and you know what? So that's realism and altruism meeting head on. Boy, do I get it. I worked those 12-hour shifts, and I remember one night working in Emerge. We were really short staff, and so there was only me and 12 people, 12 patients I was taking care of in what we called OBS. Those are people that are admitted to the hospital, but we don't have any beds for them. And I remember the physician having to come over to relieve me so I could go off to the bathroom because I was the nurse for 12 patients. Folks, I get it in spades. Please take my offerings today in whatever context you can for yourself, and I really get the reality of what you're faced with. My recommendation is if you can find a way to get that fluid into you, please do so. It really, really helps with the electrolyte balance in your body, your thinking, the way that you handle things, and your perception. I so wish I had more time with you today. I could elaborate on that. And again, sometimes it's going back to the basics that make a difference in our lives, the way that we function. We have more energy. We think more clearly. These simple tips will put you on the right path to improve, hopefully, if there is a deficit in any one of these 7 areas. Thank you, Paula, for that, and for whoever sent that in. Communicate. Okay, I'm going to put all this up on the board. All of you communicate, I would say, very well. You're in the helping profession, you're professionals, you probably communicate great. With these exceptions, when stressed or dealing with family, oh my gosh, come on, folks. How many times have you actually run to work to get away from family issues? Or, you've run home to get away from work, people at work. When we're really stressed out and we're dealing with family issues, we have a tendency not to communicate as well. We're so passionate. We want to get our point across. And sometimes we're not hearing. We all know that communication 80% of communication is just listening. Um, and it's so funny. I ran a class the other day for staff, and I did an exercise, and I said, you know what? We suck at this, and I'm going to prove it to you. And I did an exercise with them, and they couldn't believe it. I mean, I'm talking well-seasoned staff. I remember one of the staff members said to me, she'd been practicing for 22 years. She looked at me and she goes, oh God, I so have to do something about this because I'm really weak in this area. So taking a look at the way that we're listening and communicating, but stuff gets in the way. We get passionate about it, or we're just tired and we don't listen well. So what are the barriers? One of the things you can ask your family at home, and I think it's good to do a check-in and be honest. You can go home and sit down and say, look, I don't know if I'm listening well enough to you. Am I communicating well enough? And have you seen anything that, am I doing that or not doing that well? And can you tell me what's getting in the way so that we can work on bringing it down? Folks, that's just good, honest talk with the people you love and who love you. And are you providing good information to the family and friends about what's going on with you? Now, look, I understand the confidentiality piece more than most. I with you understand that confidentiality piece, and that's tough because we often can't talk about the specifics of what we're going through, but we can talk about it in generalities. During pandemic, this COVID, we need to be talking more than we used to. We need to be giving them good information. I'm not talking about bad stuff information. Yes, that's going to be in there as well, but good stuff as well, because we always have to remind ourselves that we're doing good work. And there are some really cool things happening to us at work. Let them know how you think, let them know why you feel the way that you do, and make sure that you're supporting each other. Okay. Next one, relax. Well, this is pretty, but how many people here, I so wish again I was with you, are actually taking the time for themselves each day? And I always hear, Marie, I don't have any time for myself, so on and so forth. I get that in spades. I'm asking you, please, 15 or 30 minutes. I don't care when during the day you take it, but you need to take at minimum of 15 minutes for yourself just to get recentered, just to do something good for yourself. Really, really important. Find something that works for you and do it. I've seen people roll their eyes and go, I just don't have the time. I can't do. Folks, make the time. You're important. And if you're not making the time for you, nobody's going to make it for you. Okay. Exercise. This is a key factor. It was key for me after my heart issue. Make it part of your daily routine. Heart and stroke folks tell us 30 minutes a day, 4 times a week is good. I'm sure many of you exercise. I know gyms are closing. If you can exercise at home, I do 6 days a week. I do 2 strength training and 4 cardio. My cardio are a 30 to 60-minute walk, depending on the day, but usually 60-minute walk. I don't run anymore. If the weather's bad, I use a cardio machine that I have down in my basement. But really, at the end of the day, this is imperative along with the eating. Do your exercise. And if you're dog tired coming home from work, I get it. I really get it. But find time in your week to get at least 2 to 3 sessions in minimum of some cardio. You have to do it. And here's the reason why. Those who don't make time for exercise must eventually make time for illness. Robin Sharma said that, and he is one of the sort of leadership gurus that I know, and exercise is a key component. Okay, let's get into wrapping this up because I want to give you some tools before we log off, and we're close to logging off. Here's one of the most important slides I want to show you. Your thoughts are critical, folks. I talked to you about it earlier. Thoughts that cause negative emotions are often distorted and illogical. We call that cognitive distortion, self-talk. And if you start to get into a negative self-talk cycle with yourself, that is self-propagating, and it will only lead to higher depression rates. And here's the one sent a chat piece in there a few minutes ago. Here's the one somebody talked about, socializing. So I'm glad you brought it up. Having strong social connections during COVID is absolutely critical. I'll say that again. In whatever way you can find to stay in touch My own daughter lives in another city. It's very difficult for me to stay in touch with her, but I try. I have friends in Toronto, down in Nova Scotia, and out west in Vancouver. Best I can do is do exactly what we're doing now, find Zoom, find something, a platform to use. It's absolutely critical. Key component. We are social creatures by nature. COVID has raised that level of awareness dramatically. Do what you must do, but be intentional about it. Write down a list of people you haven't contacted in a while. Friends that you just kind of take for granted. Oh, yeah, well, I call them once a year. Reach out to them, make a list. Make a list of 1 a day if you can, or at least 3 a week. On the weekend, I send out 3. I contact 3 friends. Sometimes people I talk to regularly, but I absolutely make a point of doing that. 2 of the walks that I have on the weekend, I go with 2 different people early in the morning, and I have great conversations doing my walks. We stay socially distanced, but we get a good hour walk in at the conservatory. Folks, this is important. Socialize. So I'll put this up. And I just laid that out. So be careful. Make sure you're carefully planning who's in your bubble. Okay. This is an interesting statement. Change the way you look at things in your own lives. And the things that you look at will definitely change. So let's get into this internal locus of control. I want to share this piece with you. It's called the 3 spheres of control. And I want to simply say, if you're upset, overwhelmed, dealing with something you're not sure about, I'd like you to use this little thing. Put it in one of these 3 circles. A, is it something that you can absolutely control? If so, make a plan as to what you can do and do it. 2, if it's not something you can control, if it's in the sort of middle circle, is there something that you can influence? Talk to somebody, reach out, set up an appointment, do it. But if it's something you can't control, good example is the weather. I can't control the weather, but you're worried about it, but you can't control it, you can't influence, put it there. And here's the best piece of advice I can give you. Dump it. Get it off your radar screen. You don't need to go there and you don't need to address it. So control those things that only you have control over or you can influence. But when you walk into those doors at work, there's a lot of things you can't control. As I said, can't control who you work with, can't control the patients you have, but control what you can while you're at work and absolutely be more dynamic about those 7 domains of your life, about controlling what you eat, how you exercise, sleep, the basics about socializing and communicating. Really increase the communication with your family if you don't already, and I'm not assuming you don't. Now, folks, I want to give you this. I am going to send a table to Paula. It is a very extensive table, but these are something that you can bring back to your organization. And I found this as part of a study. I think it's phenomenal. I'm bringing this to my organization on Monday. I would encourage you to do so. These were the 5 things that we heard you wanted to do, needed to do, and can address with your organization. And this is what you should be telling your organization, and I mean that in a very nice way. Here we go. Hear me. Seek opportunities to share experiences and concern with your manager if you possibly can. From the institution, protect me. Give me appropriate PPE and access to testing. Number 3, prepare me. Give me the training and support that allows me to provide that high quality care. I had to do a lot of additional training for our staff specific to COVID-19 issues. If they're not giving it to you, that's something you should be able to negotiate with them. Number 4, support me. Be flexible with my work hours and demands to address my personal, childcare, and family needs. Institutions need to be addressing this in a more tangible way. Some are doing a great job. I know that in certain departments where I'm at, they're doing a great job. Others are not. This is something you can bring forward. And the 5th thing, care for me. Provide holistic support for me and my family if I become infected or ill. You know, I giggled at this when I first looked at it. Maybe some of you are doing that right now. But I have to tell you that when I saw the graph, when I saw all of the pieces that it talked to and talked about, I think you'll have a better understanding of the platform that you can actually go to your institution, talk to your manager. Maybe it can go to the director's level. Maybe it can go to a committee that you might have for peer support amongst your colleagues. Folks, I'm at the end of this session. I know I'm about 4 minutes beyond. The first thing is I want to thank Paula again for having me. I hope, folks, you didn't see this as too rudimentary. And I will tell you the significance of taking care of yourself is absolutely critical during COVID times. And if nobody else has said this to you, I want to thank you for all of the service and work that you've done and are doing. I want you to take care of your families, be supportive, look for support, and for gosh sake, take care of your colleagues because each of you are your best support. You know what each other does. Seek it out, seek giving it, and don't be hesitant to receive the support. We always like to have that nice shield on. Well, I'll tell you, sometimes it's just nice to hear from a colleague, how are you doing? And can I buy you a coffee? Kindness and care and concern. We do that great for our patients, but sometimes we don't do it so well for each other or ourselves. I would implore you to do that. And I want to say thank you very much for allowing me to share a part of your day today. Thank you all.
Murray, you're absolutely amazing. And as expected, you delivered a really awesome talk filled with, you know, helping us kind of reframe our current situation and providing us, you know, with back to the basics, simple things, but things that can really, really make a difference. And we appreciate your time. We appreciate all of the effort that you put into tailoring this presentation to our group. I think I speak on behalf of all of us. We feel understood. I know a lot of this really resonated with the people who have attended, and we'll do so as well as we post it on our YouTube channel for those people who are caring for individuals right now. So I want to thank you on behalf of our profession and the Respiratory Therapy Society. Thank you for sharing your time and your expertise and your compassion and empathy for what we're going through, and for, you know, giving us you know, a list of things that we can do to really improve our self-care. Thanks again. You're absolutely wonderful.
Thank you.
Happy
Pleasure
RT
and
Week,
honor were all
everyone,
mine.
and thank you for coming.
Thank you. Bye-bye all.
Bye,
Take care.
everyone. We will post this presentation online, and any unanswered questions, Murray has graciously said he would provide the answers to. So we will post that on our website. And thanks again. Happy RT Week. Thanks for all the great work you all do. Bye for now.